Doctor, what types of providers help patients diagnose and manage these diseases?
So I would advocate a vascular surgeon would be the best provider to really evaluate and assess your risks and whether or not you do have a blood clot. Typically the first stage in diagnosing a blood clot or venous disease is a good physical exam.
Right.
And somebody who's had adequate amount of experience looking at this is the best route to go. The next test would be sonography, an ultrasound, duplex ultrasound, where we actually measure with which the velocity of the blood goes up and down in your veins.
Okay.
Depending on those results, then the doctor can obviously categorize the level of disease you have and what risk are you, and best tailor what may be your treatment options.
Okay, now at what point though, I mean, if you're lucky enough to go straight to your surgeon, but at what point does a specialist come in?
The vascular surgeon is your specialist. Typically, you should go see your primary care doctor.
Right.
And with your primary care doctor, you bring up your concerns and ask them, should you be evaluated by a specialist? And that's when they'll send you to a vascular surgeon who is a very specialized surgeon.
Absolutely. Now, as we get into treatments, we have a few examples that help determine the best treatment. So tell us about how you work with a patient to determine the best type of treatment, doctor.
So first and foremost, I look at the level of disease. And I also look at the patient in a clinical perspective. I find that venous disease is very patient tailored, very personalized. It's not kind of like cardiac disease where if I find a blockage, I need to open it.
Right.
A lot of this depends on the patient. So I look at the clinical disease and see the spectrum. Does the patient have troublesome varicose veins? Does the patient have swelling? Does the patient have an active wound or active skin changes? If they fall in the latter, with more severe symptoms, I often advocate more invasive treatment. If they fall in the former, maybe just some varicose veins or just some leg swelling, I always like to start the treatment with a conservative, maybe with just some compression garments and seeing how they respond to that.